Hello, Robert Bastian here to talk about the mucosa symptoms of vocal cord injury, the things that people notice when they have vocal cord injury, even if they have completely normal speaking voice. And so let's go straight to a PowerPoint, and the examples that I'm going to show you are three examples. You see this broad-based swelling, little teeny tiny elevations, and again broad-based swellings. These three people, if I had you listen to their speaking voices, you would hear nothing. You would say, sounds perfectly normal to me. And we can detect their problem if we have them do very high, soft singing, swelling check kinds of things. But their speaking voice is normal, and so these people sometimes come to the physician saying there's something wrong with my voice, and especially if the examination isn't intense like this, they may be kind of put off with an incomplete diagnosis. So the background is the traditional approach is that the doctor does the examination. So it's sort of the larynx is the province of the doctor, and the voice is the province of the speech pathologist or the voice teacher. So that's traditional in many places. Doctor, little history and examination of the larynx, and then the speech path or the voice teacher sort of interacts with the voice. I would say that that's not the best way to go about it. I think the doctor should do history, vocal capability, meaning interact with the voice, and then laryngeal examination all in one person. Much better diagnostically, I think, but this is the way it typically is. So years ago, when I began my work, I, of course, subscribed to this idea that all I'm supposed to do is ask questions and then examine the larynx. I hadn't yet figured out that I personally should interact with the voice as well. But I said to my speech pathologist, who is a trained singer, and I was a singer as well, I said, you know, there has to be a voice correlate to people who have minor vocal or small vocal cord injuries and their speaking voice sounds just fine, so we're not alerted by their speaking voice. And so she and I set about figuring out what the phenomenology of the normal speaking voice with injury was. And we came up with what we call vocal cord swelling checks. And I've got an article on that. And I also have done a video, and that video I would love for every singer on earth to watch so that they stay healthy and never need the help of somebody like me. So check those out. So symptom one, this is what patients can say to the doctor who doesn't interact with the voice and give that doctor the sense that, I wonder if there's a mucosal injury here, and then they'll look harder until they find it. So loss of high soft singing, lost voice soprano pianissimo, the ability to sing a very tiny voice way up high. And big voice is not an excuse. I've had people say, well, I'm a dramatic mezzo, so of course I can't do that very tiny high voice. And that's actually not true. I'm a baritone, but I have had a very clear high falsetto, and so that may not be an excuse. Maybe the person says, yeah, I used to be able to do really high, clear. When I was in high school, I remember singing really high and clear, and I can't do that anymore. So they're comparing with what used to be, so take note of that. Maybe they never had high soft singing, and so their assumption is that this just isn't part of my instrument. Everybody's voice is different, and some people just don't have that capability of very high soft singing. Beware of that also, because they may have an ancient but unrecognized injury. Perhaps their very first experiences as a singer included injury already in junior high or whatever. The question rises, is it technical or physical? And I would just say that even in untrained singers, people who have good ear and they can match pitch and they can do what I ask them to do with their voice, they often can do very good voice soprano pianissimo. Maybe it's not super skillful, but you can tell that there is no injury on that pair of vocal cords. Symptom two, day-to-day variability. And what I mean by that is the singer who says, I used to be more consistent. In college, my voice was more or less my voice day after day. There's always a little bit of variability where you're really hot and on one day and then it's a little harder another day. But they'll say that variability has widened. Even though I'm more experienced and more trained, I'm less consistent. That's a yellow flag at least. Some days my voice works and other days it's like I forgot how to sing. That would be a big yellow flag. Increased effort, the idea there is the person who says, I can sing to everyone's satisfaction, but I am aware that I have to push. I kind of have to bite the sound or tighten my belt. I have to kind of lean into the sound in a way that I didn't used to. And sometimes there again, people will say, well, it's a big voice, or my voice is developing. And of course, a bigger voice there has to be more effort involved. And that's a huge red flag or yellow flag. Or I have to prepare to push for high notes in order to, I'm kind of preparing a phrase or two before for that high note that's coming, and I've got to really sort of prepare in a way that I didn't used to have to. Or the singer who says, I remember earlier in my life, I just opened my mouth and sing. It just seemed effortless. And now it's much more manufactured and driven. It's a little bit more spinto. And so there we go. Reduced mucosal endurance. Singers are famous for saying, oh, my voice is tired. And what they really, I think that voice teachers should teach their singers to say instead, my mucosa is tired, which really means my mucosa is a bit swollen. Reduced mucosal endurance. And when we get a little bit of injury of the mucosa, then it seems like we add a little more injury more easily. So the classic story here is the person who says, I sing next to my roommate or my friend through the choir rehearsal. We put out the same sort of effort and sound and everything, and at the end of the rehearsal, I'm tired, vocally tired, and my friend is still fresh and ready to sing another hour. And sometimes people say, well, that's just the difference in different voices, but I think that would wave a yellow flag for me if that were the experience of a person. After my lesson, if my voice teacher gives me quite a workout, I'm a little husky for the rest of the day, and that would be a yellow flag that you've swollen mucosally. Now, if you're with a teacher who's forcing you to sing Brunhilde through the whole, but voice teachers don't typically do that, and so I would be a little thoughtful if a sort of normal sort of vocal workout leaves you a little husky. And symptom 5 is phonatory onset delays. There's a little hiss of air before my voice starts. Or I have to sing high notes louder to avoid my voice popping in a little late. And if I ask about phonatory onset delays and the singer doesn't seem to know what I'm talking about, the easiest thing is just to illustrate it. Instead of a it's kind of a there's like a C where the sound doesn't speak right when I want it to. And so you just illustrate that, and the patient says, yes, that happens to me. So the 5 in short form, number 1, high soft singing, day-to-day variability, increased effort, reduced mucosal endurance, and onset delays. If those 5 things are, or even 2 or 3 of them are kind of your issue, could be technical, but check with your teacher, a speech pathologist, or if worse comes to worse, a laryngologist. And be sure that you do the swelling checks video that I've referenced earlier, voice teacher, speech pathologist, laryngologist, and if you see a laryngologist, make sure that no matter what he or she asks you to do, while the scope is looking, you do something very high-pitched, because sometimes very small lesions that are very significant for singing function are not seen until you get to a very high pitch. Well, there it is, the 5 mucosal injury symptoms. I hope that helps, and thank you for listening.